Hi, I'm Dr. John Young here at Foundational Medicine here in Largo, Florida. And I have a good friend of mine named Bill, who I've known for a number of years.
25.
Let's see, were you my kindergarten teacher? No.
That was your first client.
Yeah. And so, known he and his family for years, and just a good personal friend. And he was in, what, a year ago or so.
About a year.
And as I'm talking to him, doing just medical workup, he's moving his head all over the place. You know, at first he's agreeing with me, then he moves it side to side. And finally I said, hey, Bill, what in the world are you doing? Your head's going everywhere. And it went from there.
Right, and I said, I'm losing sight in my right eye. At first it started kind of from the horizon down, and think of it as like looking through steamed glass. That's basically what it looks like. And then it started to kind of spread, you know, and it got a little worse, and I developed these things called floaters. And so I went to the eye doctor, and he thinks that it's the sheath or some inflammation behind the eye causing a reduction in blood, and that was the loss of sight.
So, so he gave you a pill and you were fine, right?
Aspirin.
Aspirin. Because aspirin cures everything.
Except it makes me bruise a lot, so I can't take it.
All right. So,
So then I asked you what we can do.
Now, did he say there's really, this is a, you know, in other words, it's, and for you out there, you looked at the retina looks great.
He did a battery of tests.
Right.
Everything you can imagine.
CAT scans, everything.
Everything.
Now, at the back of the retina, you have like a 3-pronged plug plugging into the retina.
Mm-hmm.
That's the optic vein, artery, and nerve.
Yep.
And he said there's a sheath.
Yeah, like a conduit, like you put wires in if you're in the house. And that conduit can sometimes break down for reasons they don't understand. And when they break down, it puts pressure or inflammation on the arteries and reduces the blood flow, and that causes the loss of vision.
So it just kind of squeezes.
Squeeze it down, not enough blood, then not enough vision.
So eventually your vision is just gone.
Foggy, yeah, getting more foggy. Eyeball is otherwise completely healthy. There's no disease, nothing. It's a blood restriction problem.
Now, is this a common problem?
The eye doctor said it was. They see a lot. Yeah, he sees it.
And so,
there's nothing they can really do because it's behind the eye, and it's a very serious operation to otherwise cut open a perfectly healthy eye for that condition. So he wouldn't do surgery. And I agreed with him.
And so I did some, you know, took my phone and Googled, and Dr. Google said, sure enough, it's a condition. They ruled out a tumor or whatever.
Right, no tumor.
And there's really no treatment.
There is no treatment because it's in the center of your brain.
Right. So I just looked at that for a while.
We started with the shot in the neck.
So, yes. And so what he said about his illness was this, that it's in part of the what's the blood vessel,
right.
The optic artery, and so that nerve is kind of, well, nerves control the muscle movement around that artery.
Mm-hmm.
So I thought deep down is probably a nerve problem, and anytime you have any disease process, especially with the nerves, mm-hmm. there's always an inflammatory aspect going on.
Right.
So I remember we talked, I did say you possibly could do stem cells, but
mm-hmm.
who knows?
Right.
And then I talked to him about a old drug that
mm-hmm.
they use for psoriatic arthritis.
Yep, Enbrel.
And I said, we could possibly try that, and you said which would work faster. Well, I think the Enbrel may work faster.
It does.
So what I did is I accessed the vertebral vascular system, which was discovered 480 years ago. And
right in the back of the neck.
Back of the neck here, about 1/8 of an inch under the skin.
Mm-hmm.
I accessed that with the Enbrel. And I wish I could have said it was instantaneous. It was not.
It took 5 minutes.
It took 5 minutes, and I was kind of bummed out.
No, I wasn't. I could see again.
So you're going to joke with me by saying, "Oh, I could see," when you got what?
Mm-hmm.
Go through that.
Well, I stood up and then I compared, and the fogginess was gone.
So you couldn't joke about it.
Right.
You
I
could
was too happy. But then after like 6 months or so, it came back.
Right.
So I don't know if that means the medicine gets consumed or goes away or whatever.
So we did it again.
Got the same result again.
Right.
Cleared it all up, and then it.
So it lasts about 6 to 8 months.
About 6 months, and then you can feel it coming back.
All
You
right.
can see it.
So you can do that as often as you want. The one thing that makes our practice, I think, different than most is that we don't do a whole lot of protocols.
Right.
And the ophthalmologists have their protocols and all of that, which are great. So not having to really rely on protocols, we can kind of freestyle for a lot of stuff.
Yes.
And so we're working on doing some things that will make that last longer. And we're going to try
As
some
in
things
permanently.
out. Permanently, right. So from a disease that had no cure to, well, maybe every 8 months I might need to get a little refresher. But just, I remember.
Or even if it's not cured, even if it just stops it from getting worse or it gets a little better, I'd be jumping up and down. Because it's your eyes. I mean, you got to see.
And so that day you were a very happy boy.
Yeah, it's great.
You're looking at everything out in the hallway. And then I'm sure your eye doctor was very, very excited that you had done so well. Is that right?
He made no comment.
None.
None.
He wasn't.
He didn't say anything.
And he, why?
I don't know. I didn't ask him.
And he doesn't tell other people that there may be hope.
Not in that respect, not for the treatment that you gave me. So, and I suggested to him, well, I think it kind of worked. And he said, well, that might be just, you're wanting it to work, or a placebo kind of effect, or maybe just coincidence. And I said, okay.
So I think it is very interesting in medicine is that if you go outside the bounds of the American Medical Association, a lot of people deny anything happens.
Mm-hmm.
And
So he was not impressed with the treatment. He didn't think it was really doing anything.
But if it was him losing his eyesight, it would be a different story.
Anybody's losing their eyesight, it'd be a different story.
So, and it was around Christmas time a year or so ago, and I said, well, that's a little Christmas gift from me to you.
Mm-hmm.
But listen, I just...
Because the medicine's not inexpensive.
No. So that's why we're working on how do we make this last longer and longer.
Right.
So I think why we're really saying this is this. We want people to know out there that even if they say there's nothing you can do, that may not be true.
Don't give up.
Do not give up. Listen, every illness had no cure at one point.
Mm-hmm.
And then we get more and more information and we can cure more and more diseases.
That's what they're doing with cancer now.
Exactly.
My wife had metastatic breast cancer, and they said she'd be alive a year, and it's been 6 years.
So
Good doctor.
I hope this just kind of gives people hope to realize that,
Don't give
listen,
up. Mm-hmm.
never give up. And if you think outside the box, you may be very, very surprised.